Hi guys, I'm Nana. I'm a final year student midwife and I'm here to talk to you about pain relief. So this is for anyone that's pregnant or is looking to give birth soon. I want to talk about the non-pharmacological methods of pain relief, and then after that I'll go into the pharmacological methods. So firstly, what could be a non-pharmacological method is using the water. Many people would like to look into or try and give birth in the water, also known as a water birth. It is a good method of pain relief. Many people do have water births. It provides moderate pain relief. It does relax you. It allows you to temporarily take your mind off the pain. Although it does not take away the pain completely, it's a good method for relaxation. And if you already plan to have a water birth, then just talk to your midwife and then they can see how they can facilitate that with you. It can be done at home, in the pool, in the bath, or it can be done on the birth centre unit in your hospital if it has one. Another pain relief method could be the TENS machine, also known as Transcutaneous End Nerve Stimulation, which is another non-pharmacological method. You can purchase it at Boots or any pharmacy, and it does help with back pain, particularly in early labour, and you can use it at any point during your labour. However, it is contraindicated if you do want to have a water birth. Because this is an electrical method of pain relief, it might not be best to use it in the water. So just consider that if you are thinking about using a TENS machine. It does help to reduce the pain that is being sent towards your brain, the messages of pain being sent towards your brain, and it can just help you to relax a little bit more. Another pain relief method that is non-pharmacological can be various things such as hypnobirthing, acupuncture, or even aromatherapy. Some midwives are trained in aromatherapy particularly, whereas some aren't. However, it's something for you to consider and just ask your midwife if there's any way that they can facilitate that for you. They do help certain scents to relax you, to also induce or stimulate labour, and it also, as I said, helps with a lot of relaxation when it comes to the early labour process and also giving birth. With the pharmacological methods, there are things such as gas and air, also known as Entonox, which is a mixture of nitrous oxide and oxygen as well. So this, I'm sure many of you have probably heard before. It is that thing that you breathe into, and it is very effective if used properly. If you are not sure of how to use the gas and air, of course ask your midwife, or also do your own research before you end up going into the hospital or before you use it. So it literally is just gas and air. You can use it in early labour. Just be conscious that the more you use it, the less effective it could be towards the end of your labour or towards the birth giving process. This is because it does allow you to become a little bit high. So make sure that when you are using the gas and air, you're using it at points where you do feel the contractions quite intensely and strongly, and just listen to the instruction of your midwife or healthcare professional that is supporting you during labour. Another method that is pharmacological includes Pethidine, which is an opiate medication. It's usually given in the leg, and it does depend on the clinical picture as to when and if you are given Pethidine, just because it has many beneficial effects for when giving birth. It is a relaxant. It can help relax your muscles. So when the baby during the process of labour tends to be quite high up, or the baby just doesn't seem to be descending as much as you would hope for, or the healthcare professionals around you would hope for, then Pethidine is a good way of potentially helping that. Not in all cases, but it is something that comes along with Pethidine if you choose to use it. Pethidine also, similarly to gas and air or Entonox, can make you feel quite a bit drowsy and also much more relaxed. It does allow you to rest during the labour process or sleep a little bit more if you felt like your labour has been quite long, quite stressful and quite tiring. Pethidine is a good option to use if you felt like you needed to relax a little bit more. And then finally, what many of you know and have heard of is the epidural. The epidural is a very effective form of pain relief. It's usually done in labour ward or obstetric settings, just because it must be done by an anaesthetist, not a midwife or an obstetrician. It is a pain relief method, the only pain relief method that allows you to not feel the pain at all. It completely takes away the pain and does enable you to rest and relax, just as Pethidine does. The only thing to be mindful of with an epidural is while it is a very good method of pain relief and it does completely take away the pain, it can increase your chances of having an instrumental, also known as forceps or ventouse delivery, and may require you to have some guided pushing when it comes to the delivery of your baby, just because you will not be able to feel pushing or you will not be able to feel the contractions when they come in order to give birth. So with all the pain relief methods available, whether they are pharmacological or non-pharmacological, it's important that you discuss these with your midwife, usually around the 36-week mark out of your 36-week gestation appointment with your midwife. You will have the opportunity to discuss your birth preferences. It's very important that I mention it is preferences as opposed to a plan, which we used to call it, just because we know that labour is very unpredictable, and while it is great that we all have plans or that you have a set way that you would like your birth to become or the outcome to be, it's important to know that things do change, and that's okay. Just making sure that your birth preferences and ideas are put forward to your midwife are important so that they know. With all pain relief methods, whether they are pharmacological or non-pharmacological, you can change your mind at any point. It's not that at the 36-week appointment, you tell your midwife that you want an epidural, that this is something that you must stick with because you said it at your appointment. If by the time birth comes, you decide, you know what, I want to be in the water, I want to be mobilizing, I want to move around, then just let your midwife know. And then it's very easy to transfer you over to the birth center or to the midwife-led unit, providing that they have space and they can accommodate you. But all in all, whatever you choose, just discuss it with your midwife. Make sure that you're aware of the contraindications and the effects of the pain relief that you might have. Whether or not a certain medical condition that you have may mean that that pain relief method isn't the best for you, or equally, if you feel like the pain relief method that you want would be good for you, but you're not too sure about what it entails or what it means for you and your baby. Just discuss it with your midwife and then you can make a plan.